everyone. Now we will be revising or learning the next set of 10 questions from NEET MDS Pulse book. So we will start the session now. Which of the following is a paired venous sinus of dura mater? Option A, cavernous sinus. Option B, superior petrosal sinus. C, transverse sinus. And option D, all. So this is the diagrammatic representation. This is the cavernous sinus and these two are superior and inferior petrosal sinus, and this is a transverse sinus. So the correct answer will be option D, all of the above. This is the next MCQ. The hypophysis cerebri is supplied by A, internal carotid artery, B, external carotid artery, C, maxillary artery, and D, facial artery. So this is the sagittal section, and this is the hypophysis cerebri or pituitary gland. Actually, the hypophysis cerebri is supplied by two arteries. They are superior hypophyseal artery and inferior hypophyseal artery. They both from the internal carotid artery. So the correct answer is internal carotid artery. Hypophysis cerebri is supplied by option A, internal carotid artery. The next MCQ. Which of the following is not correct? Option A, right common carotid artery is a branch of brachiocephalic artery. Left common carotid artery is a branch of arch of aorta. Common carotid artery divides into internal and external carotid at the level of upper border of thyroid cartilage. Carotid sinus act as a chemoreceptor. So, the first option, right common carotid artery is a branch of brachiocephalic artery. So this is the right common carotid artery. It is a branch of brachiocephalic artery. So option A is the correct option. Option B, left common carotid artery is a branch of arch of aorta. Here, this is the left common carotid artery is a branch of arch of aorta. So option B is also correct. Option C, common carotid artery is divided into internal and external carotid at the level of upper border of thyroid cartilage. So common carotid artery divides into right and left, as we all know. Internal and external carotid. Option C is also correct. Option D, carotid sinus. So this is carotid sinus. So this carotid sinus acts as a chemoreceptor. Actually, carotid sinus is a baroreceptor which regulates blood pressure, and carotid body, it is a chemoreceptor. Responds to changes in O2 and CO2 content of the blood. So, which of the following is not correct? Carotid sinus acts as a chemoreceptor. Actually, carotid sinus is a baroreceptor which regulates blood pressure. Next MCQ. The occipital artery is a branch of external carotid artery, posterior branches of external carotid artery, medial branches of external carotid artery, and anterior branches of external carotid artery. This is the diagrammatic representation. This is the external carotid artery. It gives branches, sternocleidomastoid branches, auricular branches, or muscular branches, occipital branch, and terminal branch. So finally we have to know that occipital artery is a branch of artery. So the correct answer is posterior branches of external carotid artery. The next MCQ. Rectus abdominalis free flaps is supplied by option A, epigastric artery, option B, intercostal artery, option C, iliolumbar artery, and option D, thoracolumbar artery. So this is the rectus abdominalis muscle, and this is the femoral artery and vein, and which is its branches is inferior epigastric artery and vein. This epigastric artery supplies the rectus abdominalis. So option A, the epigastric artery, is the correct answer. The next MCQ is truth about subclavian artery. So this is the subclavian artery. The first option, principal artery of upper limb. B, right subclavian artery is a branch of brachiocephalic artery. Right subclavian, so this is right subclavian, is a branch of brachiocephalic artery. So this is the correct option. Option C, left subclavian artery is a branch of arch of aorta. So the left subclavian artery, so this is the left subclavian artery, is a branch of arch of aorta. So option C is also correct. Option D, internal thoracic, vertebral, thyrocervical trunk or the branches of subclavian artery. So this is the subclavian artery, the vertebral, thyrocervical trunk and internal thoracic. So this is internal thoracic. So internal thoracic, thyrocervical trunk and vertebral artery or the branches of subclavian artery. So option D is also correct. So option E, all, is the correct option. So truth about subclavian artery, option E is the correct answer. The next MCQ, which of the following is correct? Option A, subclavian artery is a continuation of axillary artery. So this is the subclavian artery, this is a continuation of axillary vein. Internal jugular vein is a continuation of sigmoid sinus. As we all know, brachiocephalic vein is formed behind the sternocleidomastoid joint by the union of internal jugular vein and subclavian vein. So this is brachiocephalic vein. Internal jugular vein and subclavian vein forms the brachiocephalic vein. So which of the following is correct? So all is the correct option. Subclavian artery is a continuation of axillary artery. Here in the case of vein, it's the correct diagrammatic representation. So option D is the correct answer. The next MCQ is the soft palate is supplied by A, greater palatine, B, ascending palatine, C, ascending pharyngeal and D, all. So according to the options, so here this is the diagrammatic representation. Greater palatine artery. So here is the greater palatine artery of maxillary artery. Ascending palatine artery. So this is the ascending palatine artery. This artery is the ascending palatine artery. And ascending pharyngeal artery. This is the ascending pharyngeal artery. So this is the external carotid artery and this is the internal carotid artery. And option D, all. So soft palate is supplied by greater palatine, ascending palatine, ascending pharyngeal and option D, all. Option D, all, is the correct answer. The next MCQ, stages of deglutition, which is voluntary in nature. Option A, 1, 2, 3 and 4. So these are the stages. So the answer is, the first stage is voluntary and third and the fourth stage is involuntary. So we will go through the MCQ question again. Stages of deglutition, which is voluntary in nature. So option A, voluntary. So according to the question, option A, stage 1, is voluntary in nature, is the correct answer. The last MCQ, the auditory tube is supplied by A, ascending pharyngeal, which is actually a branch of external carotid artery, middle meningeal, which is a branch of first part of maxillary artery, artery of pterygoid canal, which is a branch of third part of maxillary artery, and D, all. So auditory tube is supplied by, so this is the auditory tube, the shaded one. This is the auditory tube and this is supplied by ascending pharyngeal, middle meningeal, artery of pterygoid canal. And the correct option is option D. So now we have completed all the 10 MCQs. Please go through and revise again and again for better understanding. And if you have any doubts, please comment and subscribe to my channel for more daily updates regarding MCQs from NEET Dental Pulse. Thank you.